Thank you, Chairman Hatch, Ranking Member Wyden, and members of the committee. I'm honored to be here with my very eloquent colleagues. There is attention to mental illnesses and addictions everywhere we look, from the presidential elections to the New York Times feature on the Portland police, from the 600,000 Americans who've taken a mental health first aid course to last week's CDC data showing a 25% increase in suicides in the last 15 years. But attention is not enough. It's not enough for the more than 28,000 who died from an opioid overdose. It's not enough for the more than 41,000 who completed suicide, and it's certainly not enough for their families. It's not enough, and not because we don't know what works. It's not enough because of the limited availability of what works. Respectfully, the question before you is not where are we now, but where do we need to be? If we're serious about moving from pockets of excellence that you heard about from my colleagues to the widespread availability of effective interventions, we need to stop depending upon grants and then wondering why good practices don't spread. When we have cancer or heart disease, getting access to chemotherapy or a stent doesn't depend upon our local clinic having a grant. Why are mental illnesses and addictions different? The answer to where we need to be is the Excellence in Mental Health Act demonstration, a bipartisan initiative led by Senator Stabenow and Senator Blunt. The act enables and sustains treatment systems that increase access, deliver evidence-based care, and integrate services. Discussions of acts often focus only on increasing beds. Beds can never be effective in a vacuum. Only community-based services prevent readmissions. At a time of accountable care organizations and medical homes, beds alone are not enough. Neither, for that matter, is crisis care. Standing alone, it just isn't enough. The Excellence Act establishes criteria for certified community behavioral health clinics, CCBHCs, that provide mental health and substance use services and primary care screening. CCBHCs deliver 24-hour crisis services, coordinating with law enforcement, criminal justice, and veterans organizations. But it's not just access. We need uniformly high-quality services. Unfortunately, the adoption of research-based practice is limited. An example is the successful NIMH RAISE study that improved outcomes for youth experiencing a first psychotic episode. Most communities will be unable to implement this program. Block grant funds and philanthropic grants will not be enough, and thousands of young adults will be relegated to a life of disability. CCBHCs can move the needle. They're required to offer evidence-based practices and are paid a rate inclusive of these activities. Outcome tracking and quality bonus payments. Clinics will be held accountable for patient progress, a step in our move to value-based purchasing. A key challenge to delivering science-based services is our shortage of professionals. Clinics all over the country struggle to recruit and retain staff. The fundamental barrier is that most clinics can't afford skilled staff or investments in technology to extend staff's reach. Those of you who have ever run a business know this is unsustainable. The Excellence Act offers certified clinics Medicaid payments based on the cost of treatment. They can hire critical staff and leverage new technologies. And even those historically opposed to prospective payments, like the National Medicaid directors, acknowledge there's not a better solution. The average age of death, as you've heard, for Americans with serious mental illness is 53. The culprits are heart disease, lung disease, and cancer. And people with chronic physical illnesses, as you've heard, often have comorbid depression and anxiety. CCBHCs represent a foundational opportunity to advance the way care is integrated and coordinated. Shining a spotlight into the shadows of mental illnesses and addictions is not enough. The Excellence in Mental Health Act is where behavioral health needs to be. 24 states are now planning their participation in the demonstration, yet the law sets an 8-state limit. Every state that wishes to create and sustain quality systems should be able to do so. We urge you to allow all 25 states to participate and to open the planning process to the remaining 26 states. CCBHCs will transform services in this country, and that's what I call reform. Thank you.